Hi, and welcome to Health Coaching in Clinics channel. I'm Simona Vinci. I'm a certified and UKI HCA registered health coach. Today, I would like to talk about something every clinic, hospital department, and doctors deal with, whether we notice it or not. I would like to talk about non-communicable diseases, or NCDs for short, and how poor patient implementation is silently undermining care. We look at the most common non-communicable diseases which doctors and department feel the biggest impact and why clinics lose outcomes. Not because treatment is wrong, but because advice isn't followed by the patients. So what are they? Non-communicable diseases are basically long-term conditions that aren't caused by infections or acute injuries there and then, but by lifestyle or genetics or environmental factors. Some of the most common ones include cardiovascular diseases like hypertension or atrial fibrillation, type 2 diabetes, and metabolic disorders in general. Chronic respiratory diseases such as COPD, chronic pain syndrome, obesity, and bariatric concerns, also pre and post operation. Also chronic stress, burnout, depression, and anxiety. Autoimmune and inflammatory conditions are part of them. All these conditions are hugely prevalent. In fact, non-communicable diseases account for the majority of morbidity and mortality worldwide. And they are exactly the conditions most sensitive to daily patient behaviors. So, why implementation fails then? Here is the problem. Treatment for these conditions is often highly effective. And to be so effective, they often go together with lifestyle changes patients should follow through. It's a combination of things that really give amazing results when applied in parallel. But in reality, patients forget or misunderstand instructions along the way, most commonly overlook the impact of certain body-mind modalities. Lifestyle recommendations feel overwhelming a little bit for some of them, too much of a change. Stress and emotional barriers get in the way as well. Old habits creep back in. And we know that even the small deviation from treatment can dramatically reduce outcomes. This is where most clinics lose results. Not in the clinic, but in the daily life. And this is frustrating for both doctors and patients. What if there was a simple solution? It's recognized that patients need guidance, reinforcement, support, accountability between appointments. So, which departments are most affected, notoriously? Non-communicable diseases touch nearly every department, to be honest, but some of them are particularly impacted by poor patient adherence and follow-through. Some of them are cardiology, blood pressure control, heart failure management, most MI, lifestyle changes, AF are among some, endocrinology, diabetes clinics, diet, glucose monitoring, exercise adherence, during and post GLP-1 injection courses as well. And then we come to pain clinics, chronic pain departments, rehab, graded activities, adherence to pain management or pain management programs or plans. Another area is bariatric weight management programs. Behavioral change needs to be addressed pre and post operation as well. Primary care and general practice, GPs feels, unnecessary added cost because of that. Physiotherapy, rehabilitation, daily exercise and posture improvements as well. Psychology and psychiatry, stress clinics, habit, stress and emotional regulation programs. In each of these areas, the success of medical recommendation is only as strong as patient execution outside the clinic. Poor implementation is not just a minor issue, it's a systemic barrier to better outcomes. Why clinics should care? Well, poor patient implementation affects clinic in multiple ways. First of all, the outcomes. Suboptimal adherence means slower improvement and incomplete recovery. Reputation. Patients judge your clinic by results, not by explanations. Retention. Frustrated patients may switch providers. Clinician workload. Doctors spend time repeating advice instead of focusing on complex care and investigation. Cost. Failed treatments can increase the cost, have more visit, more complications. Essentially, non-communicable diseases reveal the execution gap, the space between excellent clinical recommendation and real-world patient behavior. Clinics that ignore this gap are leaving outcomes, satisfaction, and revenue on the table, unfortunately. The opportunity. The good news is all this also is an enormous opportunity for both, for clinics and patient. Integrating health coaching, behavioral support, and implementation system, the clinics can dramatically improve adherence for chronic conditions, reduce complications and hospital readmissions, improve patient satisfaction and retention, free up doctors to focus on high-value clinical work. Departments like cardiology, bariatrics, endocrinology, pain management, and primary care as well all benefit because these are the areas where daily patient behavior has the biggest impact on outcomes. I'd like to add that helping patients to include personalized lifestyle changes has a cascade and impact of happiness in their families and well-being too. Ultimately, fulfilled and happier individuals lead to a better society altogether. So if you are a doctor, a clinic manager, a GP, or department head, understanding the impact of non-communicable diseases is only the first step. The next step is closing the execution gap, so your patient actually follow through and your clinical recommendation translate into measurable results. So subscribe to this channel because in the next videos I'll show exactly how clinics can use integrated health coaching to improve patient adherence without adding workload, which is something that nobody wants. And if you would like to have a free call with me to go deeper in your specific needs, I'll leave the link to book a call with me in the description. And thank you very much for watching. See you soon.